This is NewsBreak26 in Southwest New Brunswick. I'm Vicki Hogarth. Here's what's happening in our part of the world. A state-of-the-art CT scanner is now operational at the Charlotte County Hospital in St. Stephen, marking a major milestone for local healthcare. The ribbon-cutting ceremony on Monday celebrated the arrival of the long-awaited equipment, which is expected to drastically reduce wait times and eliminate the need for residents to travel to St. John for scans.
It supports our ER, it supports our clinics, it supports our local doctors, and most importantly, it prevents people from having to drive 100 kilometers in the winter to get a simple 15-minute procedure.
The journey to get the CT scanner began in 2022 when the Charlotte County Hospital Foundation launched a $700,000 fundraising campaign, anticipating it would take 3 years to reach their goal.
We just divided our annual income by the cost of this machine and said, well, this is going to take us 3 years. And the community stepped up, and in 3 months we were finished.
Much of this success was due to overwhelming community support during the Hospital Foundation's annual radiothon on Charlotte FM, which raised over $262,000 in one day. Just 2 months later, the St. John Regional Hospital Foundation contributed $350,000, helping the campaign reach its target. The new CT scanner is expected to serve about 4,500 patients annually, significantly reducing wait times in both Charlotte County and St. John, where patients previously could wait upwards of 500 days for an appointment.
This is the fourth CT scanner being added to the fleet of CTs for the St. John area. We say that this will bring great access to service for Charlotte County patients, but it really will benefit all patients in Horizon, even outside of St. John area. As we move towards standardization and looking at wait times as a whole across Horizon Medical Imaging, we're really looking at kind of lowering that wait time all across medical imaging to the province.
Already in use for both inpatient and outpatient care, the new scanner is helping to diagnose medical conditions, guide procedures, and monitor treatment. It has the added bonus of alleviating stresses on an already taxed healthcare system.
There was about 4,500 patients traveling to St. John for a CT, sometimes multiple times if they had to go back for a rescan or follow-up scans. And about 350 to 400 of those were by ambulance as inpatients. So when you add that complication, you're taking an ambulance out of service, you're taking a nurse out of the hospital because they have to travel, so you have 2 paramedics, a nurse, and an ambulance out of service.
Charlotte County has a long history of community-driven health care. The first hospital in St. Stephen was gifted to the community by a resident, and that tradition of community support continues to this day.
This hospital was one of the first hospitals in New Brunswick and probably Atlantic Canada to purchase an X-ray machine. They purchased a Campbell X-ray in 1920 for the grand sum of $4,200. And that was all raised by donations from the community.
The new CT scanner is a powerful testament to a community rising to the occasion, coming together to care for the health and future of its people. Firefighters in Charlotte County are having to respond to a growing number of medical calls. For more on this, here is CHCO's Nathalie Sturgeon.
The Eastern Charlotte Fire Department has seen a sharp rise in the number of medical-related calls. Councillor Mike Thompson said in the month of January, the fire department responded to 52 calls. Over half were considered training-related. Of the remaining calls, 13 were medically related compared to just 1 in January 2024. A similar trend emerged in February with 9 medically related calls compared to none the year prior.
We've seen a large rise in our medical calls.
The rise in medical calls comes as the Union of Municipalities of New Brunswick, the Paramedic Association of New Brunswick, and the Association of Fire Chiefs are asking the province to review Ambulance New Brunswick services before the potential renewal of its contract in 2027. It says the current model isn't working. Eastern Charlotte Chief Administrative Officer Jason Godet said while an increase in medical calls isn't necessarily new, it is causing issues for the department.
We're looking for some assistance from the province to sort of, on their end, to look into it as well and to come up with some answers. Long term, with these number of calls, there is going to be additional cost.
Godet says medical calls require a certain level of training that isn't traditional to the fire service. All that training must come out of the pockets of the municipality, which is already stretched thin with increased responsibilities through municipal reform. Many rural fire departments are volunteer-based only, with most firefighters having full-time jobs outside the fire service.
The evolution of the small firefighter fire departments in this area in Charlotte County has really changed in the last 30 years.
Ambulance New Brunswick did not respond to requests for comment in time for publication. Nathalie Sturgeon, CHCO-TV, Eastern Charlotte.
Thanks, Nathalie. Finally, on Sunday, the W.C. O'Neill Arena in St. Andrews played host to the Kiwanis Costume Carnival, a time-honored tradition for local families. Both the young and the young at heart dressed in vibrant costumes while taking to the ice, with kids competing for prizes and trying their luck at the famous money jar. For more than 80 years, the carnival has been a beloved winter event in St. Andrews, with parents and grandparents recalling their own memories on the same rink. That's all the news I have for you. For more stories and online exclusives, visit CHCO TV and the Courier newspaper at our website, chco.tv.
A news and public affairs production of CHCO TV, New Brunswick's only source for independent community television.